I'm the director of the Millennium Cohort Study. In recent research, I've looked at the factors affecting children's mental health up to age 14. There's an absolutely urgent need for more attention to this issue. We took into account a whole range of factors about the families, so their poverty levels, maternal education, family structure, family dynamics, and so on. And what we found that the most important influence was really the mother's mental health. We also looked at father's mental health, but we found that it was maternal mental health that was far more important than any of the other factors we were considering.
The studies that they do in relation to the Millennium Cohort Study is one of the data sources that we draw on the most in order to understand children's lives. These are the kinds of studies that are really relevant for us. We help children that are in need, particularly those who may have run away from home, for example. We also do policy and research on related issues, particularly on children's wellbeing and poverty. We're trying to identify those aspects of children's lives which are the biggest worry. So things like explanations for why we're seeing gender differences at mid-teen years, and why things like bullying and family factors are so important. We're trying to identify those issues in order to sort of generate the will and the interest in changing them, and obviously to bring about sort of policy change and attitude change and to improve things for children.
It'll be really important to understand the longer-term effects of childhood mental health. And in particular, we know that many aspects of people's lives tend to be affected, and my ambition is really to understand all of those as this cohort of children move through life.